Heart failure patients will receive palliative care from the moment they are admitted to the National Heart Centre Singapore, instead of at the end of life. With better screening and community partnership, the new Heartlanders program aims to improve quality of life and reduce re-hospitalisation. Over 9,000 patients, or about 3% of Singapore's heart failure patients, are set to benefit in the next 5 years. These patients will be screened during hospitalization with dedicated coordinators managing their clinical and psychosocial needs. After discharge, the coordinators will continue to monitor patients' conditions and connect them with suitable wellness and social programs. Heartlanders has also partnered about 200 general practitioners to support patients in living with heart failure in the community. The program received a $6.5 million funding from philanthropy house Lien Foundation, most of which will go into palliative care training.
Our vision for this is that every cardiologist who sees a patient will have in mind their palliative care needs, especially as if they have serious illnesses. Heart failure, I think it's really going to be transformed. We're very excited to offer much better community support when patients are discharged from hospital. Their journey doesn't end on the day of hospital discharge.
And we find out more from Luo Ren, Director of Special Projects at Lien Foundation, and Dr Kenneth Chew, Consultant Cardiologist at National Heart Centre Singapore. Welcome to the program. We understand that this Heartlanders program is a pioneering idea. Tell us how this thinking of embedding palliative care into heart failure care first came about. Let's hear from you first, Luo Ren.
So at the Lien Foundation, we are motivated by suffering, and there's lots of that in the world of chronic diseases, and heart failure is right up there. We have been supporting palliative care for almost 2 decades, and it's more than a medical specialty. It really is a good approach to delivering good healthcare to reduce suffering for patients. And there are 2 motivating factors for this program. The first is palliative care is often delivered too late. In Singapore, non-cancer patients receive palliative care only 9 days before death. But palliative care is not just for the dying. It really is for any patient who has needs, who has a chronic disease, such as heart failure. So we've got to go upstream way earlier than the end of life and integrating palliative care into heart failure services. So there's a much longer runway to reduce suffering. The second factor really is palliative care is delivered by too few people. To meet the rising demand of palliative care, we can't rely on the 88 specialists that we have in Singapore. And so palliative care needs to be every healthcare professional's responsibility, guided by their duty to alleviate suffering for the patient. So when we embed palliative care upstream and we integrate it into other medical specialties, such as cardiology, that's when we really enable and train other professionals to deliver palliative care to many more patients. And for this program, we were very excited to work with the Heart Centre. They were very forward-thinking and really wanted to reshape heart failure care.
So you talk about upstream, you talk about the timing of intervention. Dr. Chew, why is palliative care so important for heart failure patients?
Yeah, absolutely. Thanks for having us on the show. I think we've established that heart failure is common in Singapore. Many people suffer from heart failure. What is heart failure? It's a chronic illness. It can't really be cured. It can be controlled. It can be treated. It's usually caused by someone having a weak heart in most cases. Yet many patients with heart failure don't realize how serious it is. To put it into perspective, heart failure, it actually causes a profound change in someone's life expectancy. So someone with heart failure is expected to live between 5 to 10 years, after being diagnosed. With treatment, we can prolong life, but it's still a very serious illness, and many patients just don't have that in mind when they approach their own diagnosis. And that's why I think palliative care is so important, because as cardiologists, we're very focused on the medication to treat heart failure, the devices to treat heart failure. But there comes a point in time when, despite our best efforts, the heart failure progresses. And then what do we do? And are patients prepared for that eventuality or that possibility if it does happen? And are they able to cope? And once the medications, if the medications lose their effectiveness, then are there other ways that we can treat the patient's symptoms? Now, heart failure, it's very debilitating. Breathlessness, loss of energy, lack of strength, pain, a general loss of what we call function or quality of life. That is the burden that heart failure patients have to bear. And palliative care, early palliative care, actually helps to address this, so it's extremely important.
And earlier you were talking about how this program is a game changer. Very quickly, very briefly, how is it going to be implemented or put into practice with heart failure patients?
Well, it comes in kind of two, I like to split it into two kind of categories. I think first and foremost, this is a palliative care program. So Heartlanders is a palliative care program. And what we aim to do is to actually change the mindset of our organization, which is the National Heart Center. And we want to equip every healthcare provider or every healthcare professional in the National Heart Center through training, through outreach, and actually equip them to be able to provide basic or general palliative care. And to look at our patients. Now, palliative care, there's a lot of misconceptions, but what I've learned about palliative care is that it's really looking at your patient as himself as a person or herself as a person.
It is very complex when you think of palliative care as a medical or healthcare discipline, isn't it, Ms. Luo Ren? How do you think we can shift the mindset that Dr. Chew was talking about to recognize the value of palliative care in early stages of disease management?
Yeah, I think shifting mindsets is it's super difficult.
Yeah.
I think patients place a lot of trust in their doctor. So I feel it really has to come from doctors and other healthcare professionals, and especially medical leaders in other specialties beyond palliative care. This program is just starting off, but the hope is really to demonstrate and also for other cardiologists to see the benefits of early palliative care, to understand what it really is. And hopefully other institutions will also consider this. We do start with heart failure on this program, but we do expand to other other subspecialties at the Heart Center. Beyond cardiology, at the Lien Foundation, we actually have more programs that integrate palliative care into other specialties, because we really believe it's important that every healthcare professional needs to take responsibility for palliative care.
How do you essentially evaluate success of this Heartlanders program specifically?
Yeah, maybe I can tune in or I can chip in. So, to simplify things, three measures. One is that we want to actually reduce the number of re-hospitalizations that heart failure patients have over a period of time, any given period of time. The second is that we want to measure the improvement in terms of their quality of life using quality of life measures. And the third is that we want to evaluate this approach to heart failure care in terms of its cost effectiveness and its value. And that's what we're hoping
Ms. Luo Ren,
to use.
do you have anything else to add to that?
I think ultimately it comes down to what the patients say. It's hard to measure, but it's really important. How have we helped with their anxiety, their fears of the unknown? But also, I think for us at the foundation, it's really when palliative care becomes routine care by all healthcare professionals, that would really be success.
All right. It's a very wonderful program. We wish you all the best. Thank you very much for speaking with us. That was Luo Ren of Lien Foundation and Dr. Kenneth Chew from National Heart Centre, Singapore.